Hello, my name is Lyra Evans. I am the NDP candidate for Ottawa Vanier for the upcoming provincial election. The National Association of Federal Retirees and the Council on Aging in Ottawa have asked me to speak about 4 issues: seniors' healthcare, home and community care, long-term care, positive well-being, and income security. We'll start with seniors' healthcare. The NDP has a plan to expand public health care to include medications that people need through a universal pharmacare program, covering mental health under OHIP and ensuring a public dental program. A public dental program would cover dental care, including dentures and other dentistry-related things. As a public school board trustee, I have seen firsthand the importance of mental health coverage. Many students' mental health has suffered over the course of the pandemic, and there was a stark difference between students whose families could afford the mental health help they needed, such as therapists, and those families who could not. I also think it is foolish to have someone go to the emergency room because of a chronic problem they couldn't afford to address, stay for a few days to get healthy, then get given a prescription they cannot fill because they cannot afford the price, and then 2 weeks later be returned to the emergency room. I was taught growing up that an ounce of prevention is better than a pound of cure. On long-term care, the NDP has a plan to end private long-term care. Over the course of the pandemic, we have seen those in for-profit long-term care spaces were at a much higher risk of COVID and got significantly worse service and lower qualities of care when compared to those in public and nonprofit long-term care spaces. The NDP is also committed to hiring an additional 10,000 personal support workers to ensure that everyone in long-term care is getting enough hands-on time each day. When policymakers talk about aging, we often think exclusively about long-term care. This is not the only conversation we should be having. Many people I have spoken to are interested in aging in-home, which would be possible with only a little support. For example, they might need only 4 or 8 hours of support a week to be able to age in-home, but if they can't get that minimal support, they're forced to move into full-time long-term care, which they don't really need. I know many people would prefer to age in-home as opposed to being in long-term care. You have asked for greater autonomy and influence in policy decision-making where it relates to seniors' issues. I think this is a reasonable demand. As a longtime believer in the principle of nothing about us without us, I would ensure that I listen to affected communities when making decisions that involve them, including seniors' communities. Finally, you asked about our position on income security. The primary driver of income insecurity in Ontario right now is the cost of housing. Housing costs and housing prices have increased dramatically, and it is pushing people out of their homes. People on fixed incomes, like people on programs like ODSP or with a pension, are unable to meet the rising costs. If you owned a $200,000 house 10 years ago and paid 3% property tax, that was $6,000 a year. If your house is now worth $800,000, your property taxes are still 3% a year, but now that's $24,000. The NDP seeks to address the rising cost of housing, which is currently decoupled from inflation and therefore decoupled from many index-linked pensions through interventions in the housing market. We seek to end exclusionary zoning, the process by which a municipality draws a circle on a map and says we're only going to allow single-family homes within the circle, which will see more development of middle housing, as well as seeking to build 100,000 affordable housing units. We are also seeking to put in a foreign home buyers tax to slow the influx of foreign money into Ontario. Remember to vote June 2nd, Lyra Evans, NDP. Thank you.